Okay, so in today's video, I'm going to do Medigap Plan G versus Medigap Plan N. And as you already know, probably Medigap, Medicare Supplement, Gap Plan, they all mean the same thing. So let's jump into the stats of what these two plans have. So if we look at the chart here, we'll go over the Plan G first. Now, some of you might have heard Plan G is the most comprehensible plan out there in 2023. There used to be a Plan F, but that went away in 2020. So if you weren't eligible for Medicare in 2019 or 2020, you can't get a Plan F. So G and N are the most popular plans right now. N is, every time I talk to somebody, they're constantly talking about Plan N. So let's go over G. Plan G. What I did was I went through different parts of the country. For someone turning 65, went on my quote engine for different companies. I did an average of what someone who was 65 would be paying, and it is $140 per month. Now, you might be paying a little bit less than this, but the numbers still work because of the different data that I have. For Plan N, I did the same thing, and I came up with $106. Now, this is for a male who's 65, so a female is going to be $10 or $20 cheaper, usually, per month. Okay, so let's go from Medigap Plan G, the premium. That will be $140 a month on average. If you're 65, you multiply that by 12, obviously, because you're going to pay that every month for the entire year. So what does this give you? Your hospital coverage. You will pay nothing when you are an inpatient in the hospital. When you go into the hospital, you'll pay absolutely nothing 365 days a year. Fantastic. That's what I want to know about, is how much am I going to pay for the hospital? So you can go to the emergency room. You go stay in there for 100 days, go in and out of the hospital. It doesn't matter. You're not going to pay anything. The only thing you will pay is for outpatient services. You will pay the first $226 for the year. So let's just say you pay that $226 January by January 2nd. The only thing you will pay for the rest of the year is nothing for hospital and doctors and so forth. So if you go to the outpatient center, if you go to urgent care, if you take an ambulance, if you do, you go to physical therapy, you go to a cardiologist, you go anywhere, you're going to pay nothing after you pay this $226. So this plan is very simple. MRIs, CAT scans, all that stuff, after $226, zero. Skilled nursing, up to 100 days at zero cost. After you meet this $226 deductible for the year, everything is zero. So you pay your $140, multiply that by 12, add $226, and this is what you'll be paying for the year, $1,906. Now, this is the best coverage throughout the entire country. I wish I could get on this plan, but I can't because I'm not 65 and I'm not on Medicare. But why would you not get this plan? It's fantastic. You pay this. This is how much you're going to pay for the year. You already know, and then you're done. Everywhere you go, hospital, doctor, people tell me, hey, I didn't pay anything. Everything was covered. That's great. Let's get into the N plan and see how that compares to the G plan. So the N plan, it was $34 cheaper on average for the month. So you say, oh, that's a significant savings. Let's check out the hospital coverage. Hospital coverage, zero for both. They have the same hospital coverage. The only difference is that for the N plan, I didn't put it in here, emergency room is $50 when you go. But if you're admitted into the hospital, they waive that. It's zero. When you go for the doctors and outpatients, it's that $226, just like the Plan G, except for each time you go, you pay up to $20 after you meet this deductible. So basically, you're paying a copay each time, and that could, depending on how many times you go, that could cost you money. CAT scan, same thing as the Plan G, except for, of course, that outpatient $20 copay. Skilled nursing, That's inpatient, so you will pay zero for $100. Now, if we do the costs, $106 times 12 plus that 226 just like G, plus $20 each time you go to the doctor. I put in here that you went 20 times to the doctor. So I did 106 times 12 plus 226 plus 400 is what I put here, because it's 20 times every time you go to the doctor, and I put you went 20 different times. The number is 1,898. Don't leave the video yet. Let me get into some other things. So look at this. 1906, 1898. That's a $8 different. Plan N is cheaper by $8. And I know what people are thinking. Well, I don't go to the doctor 20 times. I only went 10 times. So knock off $200. So now you're at $1,698. So now I'm starting to think, hey, why doesn't everyone go with Plan N? Why would anyone go with Plan G? You're going to save money here. Stay with me for a second. Let's scroll down. These are the words that you're going to see when someone sends out information, or if you go to the Medicare.gov website. This is what both of them pay for. And this is just words. This is what I explained to you up top with the actual data. But look at this down here. I didn't explain the excess charge. Now, the excess charge only comes with Plan N. This is when a doctor or hospital or anybody does not accept Medicare's allotted payment. They can charge up to 15% on top of what Medicare charges. So you might say to yourself, whoa, that's a lot of money, 15% on top of it. There's two catches to this. Number one, these states do not allow an excess charge. Now, there's 50 states, and there's only 1, 2, 3, 4, 5, 6, 7, 8. But less than, I think, 1.5% or 1%. We'll just say less than 2% and keep it, 100%. Keep it 100%. Less than 2% of the doctors charge this excess charge in the entire country. So last time I checked, I think it was 1%. That was a few years ago. So the chances of getting an excess charge put on you are very slim. But do you want that? That's something that you have to decide. Both of these plans, if you take a look at my client list over here. Now, I've showed this before. If you go down and you scroll down, you're going to see this is their birth date. This is the age. I'm not showing anyone's name or phone number or anything like that. Just showing the ages and the date that they get on these plans. So let's just take this one down here. 1949. They're 73 years old. They got the plan 2014. Aetna Plan N, they're paying $140. Now you can just scroll down and you'll see Plan N, Plan G, Plan G, Plan G. And then you have a Plan F that went away, but they still are on that plan. If you look at these dates here, you have red, green, and yellow. That's when they got the plan. So if you see someone who's 70 years old or 76, they've probably been my client for 10, 11 years, whatever it's been. And I switched them from one G plan to another, or switched them from an N to a G or a G to an N. So that's when they switched, is that the first of the month in 2019, let's say. And this is the cost, $158, $165. Now this keeps going down and down and down. I'll keep scrolling down. So we have $200. And this goes all the way down to $500, believe it or not. I have a lot of clients, but if you look at this, you'll see G, N, F, and those are the only ones. Here's one PPO down here. And this is, something's off with this. But G and N, until you start getting down to the heavier payments, that's what most of my clients are on. But even with the F plan, $271. Now I found someone who, look at this, 77 years old, Plan G, paying $250 for the best coverage in the country. So when you look at this, both of these plans, and I should have went over an N plan with some of the costs there. Both of these plans are fantastic plans. So if someone were to ask me, what do you think you should get? Well, if you don't mind paying the premium of a G plan for $140, $250, whatever it is, you can't beat the coverage, and you don't have to pay a copay, so you don't have to worry about any of that stuff, the excess charge or any of that. But do I dislike the N plan? No, because the excess charge is less than 2% of the doctors charge it. I've never gotten a phone call. You saw all the end plans that I had. They're from different parts of the country. I don't get any complaints about the end plan because of an excess charge or because of the co-payments or something. The only time I get a complaint with it is sometimes when people get older and then they really get sick, they're going to the doctor all over the place and they're getting hit 20 here, 20 there, 20 there. And they call me and say, oh, I hate this plan. You know, it was great, but now I'm paying all these co-payments. And I always tell them, look, sorry that you're feeling that way, but look at how much you're actually spending for the year. And then nobody actually does that with the year. None of my, some do. Very few people budget and see, oh, this is what I paid for the year. Because I always tell them, if you look at it, and I'll tell you what you would have been paying for the G, it's probably around the same amount of money. So, Plan G versus Plan N, what is my thought? I think they're both amazing. I always tell people, hey, if you don't mind paying the premium for the Plan G, go for it. If you want to pay a little less of premium and try to save a little bit of money, go for it. You're probably going to do that. If not, you'll probably be around the same price. So, thanks for watching this video. I hope it helped you. If you have any other questions, you can call my office. Please check out some of my other videos on different subjects. And in the description box, you can click on the other videos also, besides the one that are on the screen. Thanks for watching the video. See you at the next one.